Hi, my name's Andrew Christie, and this is my ethics final video project. My project's on elective abortion due to fetal anomalies. The ethical issue I have chosen to review for my final project is elective abortions due to fetal anomalies. Full disclosure, this is not an area that I work in, but my wife has been a labor and delivery nurse for the past 11 years, and this is something that she struggles with at work regularly. Um, Elective abortion due to fetal anomalies is a controversial ethical issue in our society today. Abortion has always been a hot button issue, but this one in particular is. An example of elective abortion due to fetal anomalies would be terminating a pregnancy early because testing revealed that the fetus had Down syndrome. I chose this topic because it touches on many ethical principles, and this issue has many social implications. Ethical dilemmas from a nurse's perspective. Advanced diagnostic technologies in the field of reproduction have led to extensive application of monitoring tests and pre-birth diagnosis of fetal anomalies. Congenital anomalies are all the structural and genetic defects that would occur at the time of conception or during the intrauterine development period. With these advances in technology has come the ethical dilemmas associated with elective termination of pregnancy. From the mother's perspective, this decision carries a lot of responsibility and potentially a lot of guilt. From a nurse's point of view, these situations can be very difficult to handle. A nurse has their own set of morals that guide them in their everyday life. But in the workplace, we need to approach every situation without bias and judgment and be able to provide our patients with all relevant information in order to make an informed decision. Nurses have an ethical responsibility to protect life, which directly contradicts elective abortion. Current nursing dilemma lies in the right in the right and responsibilities of nurses towards abortion versus the rights of patients choosing to abort. With the increasing legislative activity regarding abortion law in every state, nursing position is problematic in view of respecting patient rights and professional pro-life advocacy. The role and responsibility of the nurse as well as the rights of the patients are supported within law and within ethical framework provided by the American Nurses Association Code of Ethics for Nurses with Interpretive Statements. From a nurse's perspective, if an abortion is medically indicated, meaning the pregnancy is dangerous to the mother, it is generally supported because nurses have an ethical responsibility to protect life. However, if an abortion is elective due to fetal anomaly, nurses need to respect the mother's decision if it is supported by state law. If elective abortion is against the personal or moral beliefs of a nurse, they do reserve the right to refuse to participate in the procedure except in an emergency situation. Autonomy. It is required that the patient have autonomy of thought, intention, and action when making decisions regarding healthcare procedures. Therefore, the decision-making process must be free of coercion or coaxing. In order for the patient to make a fully informed decision, she must understand all the risks and benefits of the procedure and the likelihood of success. This same principle is applied to a patient undergoing an elective abortion due to fetal anomalies. As a nurse, I may not agree with a patient going in for an elective abortion, but as a nurse, I need to provide them with all necessary information to make an informed decision. Nurses and healthcare providers need to provide this information in a way that is free of bias and opinion. Beneficence, it requires that the procedure be provided with the intent of doing good for the patient involved. Demands that healthcare providers develop and maintain skills and knowledge, consider individual circumstances of all the patients, and strive for a net benefit. In a situation such as elective abortion due to fetal anomalies, this principle is of particular importance. While this may be difficult, nurses need to keep the best interest of the patient in mind, and if this is the patient's wishes, it is the duty of the nurse to respect their wishes. As previously stated, beneficence requires that the procedure be provided with the intent of doing good for the patient involved, meaning that it is in the best interest of the patient to educate them on all risks of the procedure and explain everything that they are about to go through. In order to do what is best in the best interest of the patient, all of these topics need to be explained without bias and judgment. Non-malevolence means non-harming or inflicting the least harm possible to reach beneficial outcome. Harm and its effects are considerations and part of the ethical decision-making process. This ethical principle is a tough one to consider when discussing elective abortion due to fetal anomalies. I feel like in order to ethically apply this principle, you have to only consider the mother. The fetus may have an anomaly which is incompatible with life, and this may be the best decision for the parent. This principle can become even more difficult to follow when a fetus has an anomaly that is not lethal, such as Down syndrome. Again, this decision is ultimately up to the parent, but this can be difficult for the nurse if they don't agree with the decision. The nurse needs to approach this situation without bias or judgment. In a Code of Ethics, Provision 6.1, the environment and moral virtues. Virtues and morals are universal, learned and habituated attributes of character. There is a presumption and expectation that we will commonly see virtues such as integrity and respect in all those we encounter. While this may not be the case in the real world, as nurses, we are expected to possess these. This certainly applies in a situation such as elective abortion. These decisions are reserved for the patient and the patient only. We cannot try to influence the patient or sway them one way or another due to our personal beliefs. Again, we need to address every situation with this patient from a place of non-bias and judgment. Knowledge, skill, wisdom, compassion, altruism, honesty, and courage are all attributes that are used to describe someone who is thought to be a good moral nurse. These are very important attributes in all aspects of nursing, but especially important attributes to have when dealing with possible ethical dilemmas. Organizational ethics. Organizational ethics play a large role in elective abortions. Locally in Western New York, this is seen in the two large hospital networks. The Catholic health system does not do abortions in any capacity, or any hysterectomy for that matter. These types of procedures have to be done at one of the other hospital networks, such as Kaleida Health. Catholic Health does not support these procedures because of the belief system that guides their practice. They are opposed to abortion due to their belief system. Catholics are pro-life and do not believe in abortion. This is part of their organizational ethics. Social implications. Abortion has some serious social implications attached to it. The word abortion tends to carry quite a bit of stigma. And because of people's cultural beliefs, it remains a very hot button issue in society today. Many political candidates build their campaigns playing to one side or the other of this debate. Mothers may face ridicule from family members or even the father of the fetus. This issue is particularly difficult on the mother when the pregnancy is dangerous to her own well-being. Certain religions, such as Christianity, present significant barriers to abortion. The ethical line really does become blurry at times when discussing abortion, especially when social factors play a role. What family may think is best for the mother may be the exact opposite, and what the mother may think is best for her, she may regret down the road. But ultimately, it is her decision if state law allows. Many women speak of feeling imprisoned by their past decision to abort, but a pregnancy with guilt, or abort a pregnancy with guilt and remorse. Families are broken up over these decisions, and friendships are broken. Needless to say, the topic carries large social implications. The very mentioning of the topic can spur passionate debate. Ethical decision-making process. Step 1, get the story straight and gather relevant information. As a nurse in this situation, I would let the patient handle the conversation. I wouldn't push too hard, but instead let her tell me why she was deciding to go the route of abortion. I would fully explain to her the anomalies that the fetus possesses and supply her with any information she may be lacking. I would use therapeutic communication skills and do my best to be her advocate. Step 2, identify the type of ethical problem. The ethical issue at stake here is a mother deciding to abort her unborn fetus. Depending on what state you are in, this is a legal procedure, but as a nurse, we can ask questions and try to find out if she is being coerced into this decision or if she has fully arrived here on her own. This is a very difficult decision for any mother to make, but especially when certain belief systems are involved. Step 3, use ethics theories or approaches to analyze the problem. Veracity. This binds us as nurses to honesty. Are we being 100% honest with this patient and providing them with everything they need to make a relevant decision? Justice. We must give the patient all the treatment and attention they deserve. We must not show discrimination or judgment when treating this patient, even if we don't agree with their decision. Step 4, explore the practical alternatives. Is this a viable fetus or is this a lethal anomaly? Educate the patient on adoption. Encourage the patient to seek counseling or a support group and provide them with relevant resources to make informed decision. If the fetus does have a lethal anomaly that is incompatible with life, this makes the decision all the more hard. Does the patient carry the baby to term and deliver just to have the baby die at birth, or do they terminate the pregnancy? Neither option is pleasant, but sometimes this is reality. Step 5, complete the action. We have completed the first 4 steps of the process, and hopefully the patient is informed enough to make her own decision, free from bias and judgment, and independent from anyone else. Step 6, evaluate the process and outcome. Did we have all relevant information? We identified the type of ethical problem and did what was in the best interest of the patient. In this case, which was carrying out her wishes. We used the theories of veracity and justice to analyze our ethical problem. We educated the patient on possible alternatives. Once all these steps were taken, we acted. When dealing with ethical problems, we may not always like the outcomes, but that is not necessarily the point. Did we follow the steps in the process? We acted in the best interest of the patient by carrying out their wishes and respecting their decision. References.